to the standardized patient encounter videos. These videos are not meant to be comprehensive, but to be kind of an example for you to go by of how a patient interview should go. We'll be covering 3 different cases: a neuromusculoskeletal case, a visceral case, and then a sports physical / counseling case.
So you will notice that in these videos, we discuss the plan with the patient. As third years, you should be going through your differential while you're in the room with the patient, and it's a good idea to discuss with the patient what you're thinking and what your plan and what you're going to do next will be. We also suggest that when watching these videos, when you see the chief complaint, you go ahead and write down everything that you would do if you were going to see that patient, as well as take notes during the video and then write up a SOAP note at the end using the MBOME timer. Thank you. Come in.
Hello, Ms. Burgess.
Yes.
Hi there, my name is Kelsey Lehman. I'm a medical student working with the doctor. Is it all right if I ask you a few questions?
Yeah, absolutely.
All right, well, it's nice to meet you.
Nice to meet you.
So what brings you in today?
So I've just been having these headaches probably for about the past week, and I've noticed that they've just gotten a lot worse, so I thought I'd better come in.
Okay. Would you say it's kind of a sharp headache or a dull headache?
Definitely more dull, kind of a dull ache, and it throbs sometimes.
Okay. Is it located on any particular part of your head?
Yeah, I think I definitely feel it most like right here, and it kind of sometimes feels like really tight right here too.
Okay. Does it seem to be worse at any particular part of the day?
I haven't noticed, like, depending on the time of day, but I have recognized that if I have, so I'm a graduate student, and I'm working on my thesis defense, and I have noticed if I have like a really stressed day about that, or maybe I'm setting up a lab for the students and just a stressful day at work, it is worse after that.
Okay.
Yeah.
I'm sorry to hear that.
Oh, thank you.
That does sound stressful.
Yeah.
If you had to put it on a scale from 0 to 10, 10 being the worst pain that you could imagine, where would you put it?
Probably about a 5, right in the middle.
Okay.
Yeah.
How long does it usually last whenever you get a headache?
Usually for a couple hours.
For a couple hours?
Yeah.
Okay. Have you tried anything for it?
Yes, I have tried Excedrin migraine, which does help when I take it, yeah.
Okay, well that's good.
Yeah.
Have you had any nausea or vomiting?
No.
Have you noticed like you have something that tells you that it's coming on, like any like change in smell, vision?
No, I don't think so.
Okay. Have you had any headaches in the morning when you first wake up?
I think they tend to be more after work.
After work?
Yeah.
Okay. Would you say that it's getting progressively worse? Or does it seem like they're about the same?
It's about the same. Maybe one day is a little worse than some other days, but I don't think it's getting worse and worse and worse.
Okay.
Definitely a little bit worse than when they first started, though.
Yeah. Okay. Have you noticed any weakness in any of your extremities? No. Any numbness or tingling?
Nope.
Okay. I'd like to ask you a few questions about just kind of some of your past history, just to get a better idea of what might be going on. Can you tell me, do you drink any caffeine?
Yes, I do have a cup or 2 of coffee about every morning to kind of help me wake up. I just can't seem to wake up without it.
Okay. Have you been skipping that at all?
Nope.
Any alcohol?
I might have a couple beers on the weekend, but nothing more than that usually.
Okay. Any tobacco use?
No.
No? All right.
Wait, do you mean smoking or Or, I mean, it's neither for both.
Neither? Okay. How is your diet?
I eat pretty healthy. I try to eat a lot of vegetables, and
Mhm.
so I feel like I'm a pretty healthy eater.
Okay. Do you exercise at all?
Yes, I exercise about 3 or 4 times a week, about an hour every time.
Okay.
Yep.
Yeah, that sounds awesome. Any recreational drug use?
No.
And you said you were a grad student, and that's been pretty stressful. Okay. Let's see. Do you have any past medical history?
When I was younger, I did have seasonal allergies and eczema.
Mm-hmm.
Yeah.
Okay. And how are those now?
They're okay. I have to take some like Benadryl kind of to help with the allergies because I still have those a lot, but I haven't had an eczema breakout in quite a while.
Okay. Any drug allergies that you know of?
No.
No? Okay. Have you had any surgeries in the past?
No.
Any hospitalizations?
Nope.
Can you tell me about your family's history, like your mom and your dad?
Yeah, so my mom does have hypothyroid,
Mm-hmm.
and then my dad, he does have high cholesterol and high blood pressure.
Okay.
And I do have a grandma that had died of brain cancer.
Oh, I'm sorry to hear about
Yeah, and I guess kind of the reason I came in is because I've been a little bit more worried about ever since that happened.
that. Mm-hmm.
Do you think that this could be cancer?
Well, some of the symptoms that you're describing to me aren't really leading me to think that this is cancer. However, I am glad that you came in today,
Okay.
and whenever I bring this up with the doctor, we'll be sure to address that. But as of
Okay.
right now,
I
that's not really
appreciate
what
that.
I'm thinking.
Okay.
Let's see. And then you said you take Benadryl occasionally. Any other medicines?
Nope.
No? Okay. All right. I think that's about all the questions that I want to ask you. Is it all right if I do a quick physical exam?
Yeah, that sounds great.
Okay. I'd like to listen to your heart first. Is it all right if I pull your gown down a little bit?
Yeah, of course.
Okay. And the last spot we'll listen to, I'm going to come around to the side.
Okay.
Good. And now we'll listen to your lungs. So
Okay.
I'm just going to kind of scoop your gown to the sky.
Okay.
Take a deep breath in and out through an open mouth. One more. And another. And last one. Good.
Does everything sound okay so far?
Mm-hmm.
Okay.
All sounds good.
Okay.
I'm going to check your eyes now.
Okay.
So just look straight at the tip of my nose. Good. Now I want you to follow my finger with your eyes. Don't move your head. Good. All right, I want you to close your eyes. I'm going to touch both sides of your face. I want you to tell me if they feel equal and the same.
Yep. Yeah.
Okay, good. Now I want you to try to make some funny faces. So
Okay.
puff out your cheeks, raise your eyebrows, and then squeeze your eyes really tight. I'm going to try to open them. Okay, good. All right, and now I want you to shrug your shoulders against me. Good. And relax. Good job. All right, that all looks good. I would also like to try something called OMT, which is osteopathic manipulative therapy.
Okay.
So I'm just going to kind of feel on your neck and see if I can loosen up some of those tissues that may be contributing to this headache.
Okay. Yeah, I think a friend of mine had a really bad headache, and she went to a DO,
Mhm.
and she said they did something like that, and it made her feel better. So you're going to possibly do that to me today?
Yes, I would
Awesome.
like to try.
Okay.
All right, first I'm going to get you a gown. this on. Okay. And I'm going to pull out this footstool for you. And I'm going to have you lay down. Okay. So I'm just going to touch both sides of your neck. Let me know if any of this is uncomfortable for you, okay?
Okay. No, it actually feels really good.
Good. I'm just going to work on loosening up those tissues because you're probably super tense. You've got a lot going on right now. And so kind of what some of your symptoms are telling me is this is probably a tension headache.
Okay.
Probably just because you've got a lot of stress going on in your life.
Okay.
Yeah, so what I want to do, I'll go talk with the doctor for sure, and we'll be back in to talk to you more, but I want you to continue that Excedrin migraine.
Mm-hmm.
Let's see. And then we'll also probably give you some self-stretches to do at home.
Oh, okay. So you think my neck is contributing to this?
I think so, probably.
Okay.
Or at least it in some way.
Okay.
So hopefully some of this OMT will help. Okay, I want you to just relax. Let your head fall back into my hands. Good. Okay. Okay, I want you to try to return your head back to its normal position. Good. 1, 2, 3, 4, and relax. I want you to do that again. 1, 2, 3, 4, and relax. And last time. 1, 2, 3, 4, and relax. Okay. That feels better to me. Does that feel better to you?
Yeah, it feels a lot looser.
Okay, good.
It really does, yeah.
All right. I'm going to help you up.
Yeah, it does feel a lot better.
Good. Do you have any other questions for me?
No, I think you answered it. I think I was really worried about the grandma, my grandma's history of brain cancer, but I feel a lot better now.
Okay.
Yeah.
Well, I'm going to go talk with the doctor. We'll probably come back in and talk to you a little bit more, see if he has anything to say. We may do a fundoscopic exam, which is where we look at the back of your eye
Okay.
when we come back in.
Okay.
Is it all right if I come back in with him?
Yes, absolutely.
All right. Well, it's very nice to meet you.
Thank you. It's nice to meet you too.
Come in.
Hi, Miss Lehman.
Yes.
Hi, my name's Alexis Bridges. I'm a medical student working here with the doctors in the emergency department. Is it okay if I come in and ask you a few questions?
Yeah, sure.
Awesome. Well, it's nice to meet you.
Nice to meet you.
You don't look like you're feeling very good.
I'm not at all.
Okay, well, tell me a little bit about what's going on.
My stomach just hurts really bad.
Okay, where at on your stomach?
Like, well, it was like right here, but now it's like really bad over here.
Okay. And when did this first start for you?
It started last night, but it wasn't that bad.
Okay. It kind of has gotten worse?
Yeah.
Okay.
It's gotten a lot worse.
Can you kind of describe the pain to me? What it feels like?
Well, it was kind of like a icky, achy kind of feeling, and now it's really sharp. Like it feels like someone's stabbing me.
Okay. Oh, I'm sorry. That sounds awful.
Yeah.
Okay. Well, hopefully we'll get this figured out and get you feeling better. So while we're talking about your pain, if you could rate your pain on a scale of 0 to 10, 10 being no pain, 10 being you would pass out, the pain is so bad, what do you think you're at right now?
Probably a 7.
Okay.
I would say.
Okay. So is there anything that you've noticed that makes the pain worse?
Well, probably like even just like riding over here in the car, it like just going over a bump would just like be excruciating.
Jeez. Okay.
Yeah.
Okay.
So just movement in general.
Okay.
hurts.
Okay. And have you tried anything to make it better? To make the pain go away?
I took some ibuprofen,
Okay.
but it didn't help at all.
How much ibuprofen did you take?
Oh, it was just like 2 tablets, so like maybe 400 milligrams or something.
Okay. And then have you noticed anything else going on? Any other symptoms besides just the pain?
Well, I feel like I'm gonna throw up.
Okay. So you're nauseous.
Yeah, and I just feel really hot. I haven't actually taken my temperature,
Okay,
but
you haven't
I feel
taken
really
it.
warm.
Okay. So I'm gonna ask you a few other things. Have you any constipation?
No.
Okay. How about diarrhea? No. Have you traveled anywhere recently?
No.
Okay. And then have you noticed any blood in your stool?
None that I've noticed.
Okay, not bright red or maybe like dark black appearing?
No.
Okay.
It's been normal.
Okay. And then are you kind of having some chills with the kind of warmness that you're feeling?
I don't think so.
No chills?
No.
Okay. And no recent weight loss?
No.
Okay, good. Okay, well I think I've gotten a lot of good information about what's going on right now. I just want to ask you a few quick questions about your history, and it's just to give me a better idea of everything that's going on today.
Okay.
Is that okay?
Yeah, that's
Okay.
fine.
So what's your diet kind of like?
I eat pretty good.
Okay.
Try to stick with veggies and protein.
Okay, so eat a healthy diet. Any tobacco use, either smoking or chewing tobacco?
No.
How about alcohol use?
Oh, like maybe a glass of wine over the weekend.
Okay. And then any other illicit or recreational drug use?
No, none of that.
And are you currently working or going to school?
I'm a college student.
Okay. Where at?
Mizzou.
Awesome. What are you studying?
Chemistry, actually.
Oh, very cool. Okay. And then do you have any past medical history that we should be aware of?
Not really. I don't
Okay.
think so. I had asthma when I was young, but that was it.
Okay. Have you had a recent flare of that? Okay.
No. It hasn't bothered me since like middle school.
Okay. Any allergies?
I do have a sulfa
Okay.
allergy.
Okay. Good to know. And then how about any allergies to any foods or anything?
No?
No.
None that I know of.
And then are you taking any medications? No.
Well, I guess my birth control.
Okay. And that's a pill form?
Yes.
Okay. And have you ever had any surgeries before?
No.
No.
Mm-mm.
How about any hospitalizations at all?
Mm-mm.
And then are your parents alive?
Yes.
Okay.
They are.
Good. And what is their health like?
My mom is healthy. I think my dad has hypertension.
Okay. Any siblings?
No.
Okay, well, at this time, I think I've gotten a lot of good information, so I'd like to do a brief physical exam on you at
Okay.
this point, if that's okay.
Yeah.
Okay, so first thing, I'd like to listen to your heart, okay? Is it okay if I go under your gown a little bit?
No, that's fine.
Okay. I do have one more spot I'd like to listen to, but I need to get under right here. Is that okay?
Mm-hmm.
Okay. Your heart's beating just a little bit fast, but everything else sounds really good. So now I'm going to listen to your lungs, so I'm just going to have you take a deep breath in and out through your mouth, okay?
Okay.
Go ahead. Good. 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 And last one. Good. Your lungs sound great. Now, since I am a DO, I would just like to really quickly just evaluate your thoracic spine, just to
Okay.
kind of check your alignment. Let me know if there's any unusual tenderness anywhere. Everything feel okay?
Yeah, feels fine.
Okay. Good. Okay, I'm just gonna feel some pulses real quick. Okay, and just a couple down here. Okay, so now at this point I am gonna examine your abdomen if that's okay. So I'm gonna give you a drape because I will be pulling the gown up.
Okay.
Okay? So if you would like to just bring your gown up for me, perfect. I'll keep you draped. And then you can go ahead and lay back. Good. Get this for your feet. Perfect. So kind of while you're right here, can you just gently point to me where it's hurting right now?
Right now it's hurting right here.
Right down there? Okay. I'm just gonna listen first. Okay, now I'm just going to be tapping on your abdomen. Okay, and I'll start away from where it hurts the most. So how is this? Any tenderness?
That feels okay.
Okay. Is that okay?
Feels okay.
Alright, and I know this is where I'll try to go easy, but is this
Yeah.
that's a little bit tender?
Yeah.
Okay.
Yeah.
So I'm going to do a couple special tests. I actually just want you to take a big deep breath in for me. That feels okay? And then if I were to press right here,
Yeah.
that's really
Yeah,
tender?
That hurts.
Okay. Just in general, I want you to, I'm just going to, now did that hurt worse when I pushed or when I let off?
When you let off.
Okay. And how about if I do that over here?
Yeah.
Okay. And where did you feel that at?
I felt it over here.
More over there? Okay. And I am going to bend this leg just a little bit. And I want you to try and push this leg up against me.
That hurts.
Where is that tender at?
Same
In that
spot,
area?
Yeah.
Okay. We can put this foot down and I am just going to kind of hit your heel.
Ooh.
That tender
Yeah.
as well?
Yes.
Okay. All right. Let's go ahead and put your gown down. Okay, and I can help you back up. I think that's all the exam that I'm going to be needing to do right now, and I know that you're in a lot of pain, so thank you for bearing with me through that. What you're describing today seems a little bit as if your appendix might actually be infected.
Oh, okay.
So what we normally do for that is contact a surgeon, which I'm going to go leave the room and talk with the physician, and we'll probably be referring a surgeon, and then they will talk to you about getting that removed. They might want to put you on some antibiotics. What I'm going to do in the meantime is probably get a CT scan, and I know this is a lot of information at once. We want to make sure that it's just infected and it's not actually ruptured
Okay.
open.
Yeah.
And then I'll actually probably just get a couple simple blood tests just to make sure, just to check a few things.
Okay.
How does that sound to you?
Kind of scary.
It is scary. It is scary, but I truly think that we're gonna get you taken care of and get you feeling a lot better.
All right.
Is there anyone I can contact for you?
Well, my boyfriend's out in the waiting
Okay.
room, so
Well, I can have the nurse go out and get him and
Yeah.
bring him in here so he can sit
that'd be
with you.
good.
Okay. Is there anything else? Any other questions you have for me?
No, I don't think so.
Okay. Well, I'm gonna go talk to the physician and we'll be back in a little bit. Okay.
Thank you.
It was nice to meet you.
Come in?
Miss Lehman?
Yes.
Hi, my name's Alexis Bridges. I'm a medical student working with the doctors here at the clinic. Is it okay if I come in and ask you a few questions before you see them?
Sure.
It's nice to meet you.
Nice to meet you.
So real quick, I just want to have you confirm your date of birth for me.
So that is July 31st, 1997.
walking in today?
I'm really just here just to get a physical. I'll be playing volleyball in college.
Awesome. And so you're just entering college as a freshman? Congratulations. What college are you going to?
Mizzou.
Okay. And volleyball, you said. So it's a sports physical. Well, other than that, is there anything that has come up that you'd like to discuss besides that, or is that pretty much it?
Well, I have one of my friends got the Gardasil vaccine.
Okay.
So I was interested in that, I think.
Okay, and you've not had any of those before?
No.
Okay, yeah, absolutely. We could talk about that. Speaking of vaccines, are you up to date on all your other vaccines?
As far as I know, yes.
Okay. There is one vaccine that they like to give students before they start college. That's for meningitis. Have you had that before?
Oh, I don't think I have.
Okay. Well, we can do that today too. So I'm just going to ask you a few questions about your history, just to give me a better idea of your overall health. Do you take any medications?
No.
Okay. And do you have any?
Oh, actually, I do take a birth control.
Okay. Okay. Perfect. And then, do you have any past medical issues, maybe as a child or anything?
No, I was pretty healthy.
Okay. Have you ever had any surgeries?
No. Oh, yes. I had ear tubes.
Oh, okay. Did you have like recurrent ear infections as a child or something?
I guess so.
Okay. And then, ever been hospitalized?
No.
Okay. Do you have any allergies to any medications?
Penicillin.
Okay. Good to know. Do you have any allergies to any food or anything else?
Oh, peanuts.
Okay. What happens when you're around peanuts?
My throat will like swell up.
Okay. And then, are your parents alive?
Yes, they are.
Okay. And what's their health like?
Both of them are very healthy.
Okay. Mom and dad?
Yes.
And then, do you have any siblings?
No.
Okay. Does any type of cancers run in your family?
Yes, my dad's dad had colon cancer.
Okay. Good to know. Okay, so now I'm just going to ask you a few just general questions. It's just kind of giving me an overall idea and making sure that there's no red flags. You know, something might be normal to you and you not think it's that important to bring up, but would be important to me to know about. So I apologize, this is a lot of questions.
Okay.
Do you have any new or abnormal headaches?
No.
Okay. Vision changes?
No.
Okay. Dizziness?
No.
Okay. How about fever?
No.
Chills?
No.
Weight loss?
No.
Unintentional weight loss? Okay.
Neither.
Difficulty swallowing?
No.
Okay. Have you noticed that you're drinking more than usual? No. Good. How about nausea or vomiting?
No.
No to both?
Right.
Okay. Any chest pain?
No.
Palpitations, like your chest, heart's kind of beating out of your chest, it's kind of fluttering?
No.
Okay. Any shortness of breath?
No.
Good. Especially, so even when you play sports, you don't feel out of breath?
Usually not.
Okay. Good. Any abdominal pain?
No.
Diarrhea?
No.
Constipation?
No.
Good. Do you ever notice any blood in your stool?
No.
Okay, good. Any difficulty urinating?
No.
Any blood in your urine?
No.
Good. Any joint pain?
Maybe occasionally after a hard practice, but
Okay.
overall no.
Something that you just kind of take ibuprofen for
Yeah.
and it goes away? Okay. Any tingling in your arms or legs?
No.
Any weakness in your arms or legs?
Not that I've noticed.
Okay, good. Okay, that's all of those fun questions. So now just a few more questions just to get you to know you better. What is your diet like?
Oh, overall okay. I do eat some fast food occasionally.
Okay. And then obviously you're athletic, you're playing a sport. How many days a week would you say you exercise?
We have practice at least 5 days out of the week.
Okay. Any tobacco use?
No.
Okay. And anything you say to me stays between the two of us. I just want you to know this is a safe room and I'd like for you to be as honest Any alcohol use?
No, just on the weekends. Occasionally I'll go to a party.
Okay. How many drinks would you say you have at a party?
Maybe 4 or 5.
Okay. So you know to always get those drinks yourself, not to let someone else bring them to you.
Mm-hmm, for sure.
Good. Any recreational drug use?
No.
Good. How about your caffeine consumption?
I'll drink like an energy drink, maybe once a day.
Okay. And then your sexual practices, how many partners have you had?
3.
3.
Mm-hmm.
And then do you use protection?
Most of the time.
Most of the time?
Yeah.
Have you ever been tested for any STDs or STIs?
No.
No. Okay. And then, do you wear your seatbelt in the car?
Sometimes not.
Okay. And then how about sunscreen? Do you apply sunscreen?
Yes.
Good. And then wear your helmet if you ride a bike or anything?
Yeah.
Good.
Haven't really ridden a bike, but
okay. So I think that's all the questions. I know it was a lot of questions I have for you. At this time, I'd like to transition over to a brief physical exam. Is that okay?
Yeah.
So I'm going to start with just listening to your heart, if that's okay. I might have to go under your gown a little bit. Is that all right?
Okay.
Just breathe normally. And there is one more spot I need to listen to that's kind of right under this left arm.
Okay.
That's okay. Good. Okay, your heart sounds good. So now I'm going to listen to your lungs. So I just need you to take a deep breath in and out through your mouth. Good. And last one. Good. And since I am a DO, I'm just going to palpate your thoracic spine a little bit, checking the alignment. So just let me know if it's abnormally tender anywhere.
Okay.
Does that feel okay?
Yep, feels fine.
Okay, good. Okay. I'm just going to have you look at me. Good. And follow my finger with your eyes and try not to move your face or your head. Good. And stick out your tongue. Good. Just going to look in your ear. Looks good. And do the other side. Very clean ears. And now I'm going to look in your nose, so just kind of look up for me. And then open, say ah. Again. Good. And I am going to palpate your thyroid, okay? So I'm going to be palpating just this area, just to let you know. And now swallow for me. Good. And just checking for any lymph nodes. Good. Feel some pulses. Good. And now pulses on your feet. And now just try to relax for me. Good. some reflexes on your legs. Woo! Good. And now just on your feet. Good. So just touch your feet. I will wash my hands a little bit. So now we're just going to do some muscle strength testing. So first I'm just going to have you put your arms straight out to the side for me. Straight out. There you go. And don't let me push them down. Don't let me push them up. Good. Now bring them kind of in like this and bring them up towards you. Good. Now push me away. Good. Have your fingers all the way out. Don't let me squeeze them together. Now put them together. Don't let me squeeze them apart. Squeeze my fingers. Good. Actually, I forgot one, so I'm going to have you kind of go like this. And now try to raise them up and raise them down. Good. So now the same with your legs. Kind of push your legs up towards the ceiling. Good. And now bring each one down. Good. Good. Bring them apart. Bring them back together. Good. Kick your feet out and bring them back towards you. Good. Point your toes up towards the ceiling and then down on the gas pedal. Perfect. Good. And last things, I'm just going to kind of look your skin over, make sure there's nothing, any scrapes or rashes or moles that you've noticed that you would like looked at.
I haven't seen anything.
Okay, nothing on your legs. Good. Okay, so that's it for the physical exam. So at this time I just want to talk about a few things. When I leave the room, I'll get the nurse and we will definitely do the 2 vaccines, the meningitis and the Gardasil. And then I'll have her set up a nurse appointment to contact you when to get the next Gardasil. The other thing that I just wanted to talk to you about was remember that you are underage. And I'm glad that you were honest with me. I want you to be honest with me, and this doesn't, leave this room. But just be careful because it is illegal for you to be drinking, and especially be careful at those parties. And then if you're ever driving, make sure not to ever drink and drive. When you do drive, always wear your seatbelt also. Is there anything else? Oh, and the last thing before I forget is since you sometimes use condoms and not always, and you've never been tested for anything before, I think it would be a good idea to go ahead and do some just generic screening tests for any sexually transmitted infections or diseases. How does that sound to you?
That sounds fine.
Does that sound good?
Yeah.
Okay. And do you have any questions for me?
Not right now.
Okay. Well, I'll go speak with the doctor and we'll be back in to get that blood work.
All right.
Thank you.
Thank you.